So for starters, why this pause on alcohol for bars and restaurants?
Sure. So this is one evening, one night where we are asking bars and restaurants not to serve alcohol after 5 o'clock and then not have alcohol present after 6 o'clock. So it is not a general ban. It is for one evening, the night before Thanksgiving. We are in an unprecedented surge of COVID-19 in Pennsylvania, which is the same surge that is being seen throughout the country. So every single state in the United States, except for Hawaii, the island state of Hawaii, is seeing this increase that we are seeing. We are seeing increasing number of new cases as well as increase in our percent positivity, and that is throughout the state. And so, there are three ways to deal with the pandemic. We can work to contain it, we can work to mitigate its spread, and then we have the hopeful development of a vaccine coming. So we realize that small gatherings in indoor settings, such as restaurants and bars, significantly contributes to the spread of COVID-19. We do have some basic mitigation efforts still in place with those facilities. But we know that the night before Thanksgiving happens to be a very, very big drinking night. And if people are drinking large amounts of alcohol, then they might not practice social distancing and mask wearing as much as they should because they're disinhibited in some way. And so we want to preempt that from happening and try to stop the spread of COVID-19 in Pennsylvania. So that is why we're taking that one night's action to try to not have an enormous bump of COVID-19 in 2 weeks.
Now, what is stopping Pennsylvania residents from just crossing over the border? Like I mentioned, WETM, we cover Tioga, Bradford County, and we are right at the border, just 10 minutes away. So what's stopping those residents from crossing the border to go out and consume alcohol, or not tonight, tomorrow night? Are you working with the New York State Department of Health as well on this, or how are you going to enforce this?
So we will be able to enforce the limits on alcohol, through regulatory efforts and with the Pennsylvania State Police and the Alcohol Board, etc. We can't prevent people from driving across the border. We do have actually a testing advisory, a testing order actually, that if you go to another state, that you get tested before you come back. But you're right, it is very hard to enforce that. We don't have the Pennsylvania State Police on every street, between two different states. So, we are blessed with freedoms, tremendous freedoms in our country. But with those freedoms comes responsibility. This is not a new concept. This is since the beginning of our republic. And there is a collective responsibility we have to ourselves, to our families, our neighbors, and our communities. And right now, in the midst of this global pandemic of this novel coronavirus, that means wearing a mask. That means washing your hands. It means avoiding large and small gatherings. It means social distancing. And I think that we owe it to ourselves and our communities to take those public health measures, those relatively simple public health measures to protect all of us from the spread of this virus. And so the governor and I really think that Pennsylvanians are strong and resilient people and that they will do the right thing. Is it possible to drive to New York and then drive back? It is. But as the governor says, for instance, we have seatbelt law, we have seatbelts, and we have seatbelt laws. But what really keeps people using seatbelts is because they want to protect themselves and their family from having serious accidents. Well, in the face of this global pandemic, that means wearing a mask, social distancing, avoiding these type of gatherings.
All right. Now, would you say this is a form of prohibition on businesses that do sell alcohol?
No, these are mitigation efforts. There are three ways to deal with the pandemic. The first is containment. Containment means expanding testing, which we have done. We want to expand testing more. It means contact tracing, those that are exposed to the virus. It means isolation and quarantine of those sick or exposed to contain the spread. The second tool in our toolbox is mitigation to stop and mitigate the further spread of the virus if it occurs. And these are the measures that we've been talking about right now. And the recommendation, really, the advisory that really people should stay at home. People should stay at home during Thanksgiving. People should stay at home, work from home if they possibly can. And if they don't really have a compelling reason to go out, please stay at home. These are trying to mitigate the spread of the virus. The third are medical measures, and that includes new medications like the monoclonal antibodies that are being distributed now, as well as the vaccines, which have very positive messages and news about the vaccines. And I think that over the next 6-9 months, we will have significant medical advances that will help us. But it's going to be pretty limited over the next 2 or 3 months. And the country is exploding with new cases. So we all have to stand united, answer the call, and work together to stop the spread while we work to distribute and administer the vaccines over the next 9 or more months.
Okay. Now with this mitigation put in place, what would you say when it comes to restaurants that do serve alcohol? What is the difference between a group of people sitting at a table eating dinner at a restaurant drinking soda compared to another group sitting at the table eating dinner but consuming alcohol?
Well, the difference is that people drinking soda aren't going to become potentially disinhibited and less likely to social distance and wear masks, etc. But really, again, we have a stay-at-home advisory. If at all possible, we want people to stay at home. We want people to stay at home during Thanksgiving. We want people to stay at home within their household and not have gatherings, even in their home, because those have been shown throughout the country to spread the virus. And that's going to be true for Christmas and Hanukkah and Kwanzaa and New Year's as well. This is going to be a very challenging 3 or more months as the vaccines get approved, and then we work to distribute and to administer the vaccines. I'm a positive and optimistic person. There is a light at the end of this tunnel. And I think in a year, we're going to be in much better shape in regards to this virus. But the next 3 months or more are going to be a very serious challenge. And we need to stand together and stand united to fight this virus.
Now my last question for you is, on the topic of light at the end of the tunnel, a lot of small businesses have been hurting since the start of the pandemic, since the first shutdown ever. And some of them still haven't even recovered from the first phase. And here we are entering a second phase. And now they're being told they can't serve alcohol, or they can't operate for tomorrow night. What do you have to say to those businesses?
Well, this is a real challenge for those businesses, and the governor and I and the administration certainly feel for those small business owners, and that is why the governor has been calling upon the legislature to work with him to pass measures to support those businesses that are hurting. And so, in the new term, we call upon the legislature again to work with the governor to pass economic support for those small business owners. We also call upon the federal government and Congress to pass the CARES Act too, and the president to sign that, because the country and Pennsylvania, of course, needs more economic support. We also need more funding for more testing, for more contact tracing. We need more funding for the vaccine. And so Congress needs to act. And in the new term that starts in January, the legislature needs to collaborate with the governor to act to support those small businesses as we continue to fight together against this virus.
All right. And that is all the questions I have for you, Dr. Levine. But is there anything else that you want to add that we didn't touch on, or that you didn't mention, that you want everyone to know about regarding Thanksgiving gatherings, the mitigation for tomorrow night, or anything at all?
Well, it's a little bit of a repeat, but I'll say it again. I think that we all have this shared responsibility to each other. And I think that we have to care about our neighbors, about our friends and family, and our communities. There is no doubt that this is an extremely contagious and a dangerous virus. We have increasing case counts. We have increasing rates of hospitalizations. And tragically, we have increasing rates of deaths. And so people should not be complacent about this virus. They have to take it very, very seriously. So please stay home, stay calm, and stay safe.
All right, sounds good. Thank you so much.